this episode of Horse Shelter Heroes.
Dr. Gina and Kory and I are going to be working through some castrations.
As you all know, I got in a wreck recently and my truck was unfortunately totaled.
We are going to pick up a few donkeys.
We have 2 visitors here at Horse Plus this morning. They have come to job shadow with us.
Hey everybody, today is volunteer day.
He is a 13-year-old Mustang. I decided that we're going to do a complete restart on him.
We are so excited that Cuddles is about to get his forever home.
And they called us over to come look at him because he was really struggling to breathe.
So today we have some adopters and they are very interested in Crixus.
You don't want to miss a single second of Horse Shelter Heroes.
Trying to catch up and trying to make priorities, and we're gonna try to tackle some castrations today, but we also have a bunch of horses that need vaccine boosters and pregnancy checks and dentals, and we could stay busy for a really long time. But we're trying to look at the facilities that we have and the staff that we have and see how much we can accomplish in this morning.
Right now I'm just getting this swept up. We're going to do a few castrations in here. So we just want to make sure all the manure is out of the way, just to help make it a little bit more of a clean environment for the surgeries.
The plan for today, Dr. Gina and Kory and I are going to be working through some castrations. We have a long list. I think we're going to try to get through 2 to 4 donkeys and 2 horses today. We're making priorities. We've got horses that people are interested in that haven't been castrated yet, and then we have a bunch of donkeys that are down here in general population, and we have 8 more donkeys coming in today. Trying to get through some of those. We're sending Caitlin with Taylor. Taylor is Kory's new assistant, and they're going to be running up some fields of horses that are due for vaccine boosters. And then while they're going through that, Caitlin will let vet staff know if there are any concerns. So we're gonna try to accomplish a lot at one time, and we'll see how it goes. Someone come and adopt kittens. We love them, but they are in the way. Our first patient of the day today, Jack, is estimated to be about 20 years old. The older they get, the higher those risks go. This particular donkey is otherwise relatively healthy. He does need some footwork, but he's very, very sweet. He lets you walk right up to him. I think he's a great candidate for adoption. So, cost-benefit analysis, it is worth the added risk to try to castrate him at his age. And we hope that he handles anesthesia well. And so sometimes, if we get stallions that are in their 30s, the recovery is a lot harder, but we're gonna give him good pain meds today and be as quick as we can, and hopefully all will go well.
Yeah, so sweet old Jack has decided that he's going to go down for his anesthesia in the chute. So now things have to be open so that the vets can get to his testicles so they can be removed.
Jack's castration has gone well. He had emasculators placed on both testicles, and then I used OTT PDS, which is a absorbable suture, to ligate both sides using a modified Miller's. Initially, when he went down under anesthesia, he was very reactive and had a lot of muscle rigidity, so we gave him a little bit more midazolam, which is a muscle relaxant, also an anti-anxiety medication and amnesia drug, which is great. And so he is snoozing. We're gonna leave those emasculators on kind of as long as he lets us. Ooh, I might nip his hooves off. So now we're just waiting as long as we can, as long as he's not moving, to leave those in place. And then when he starts being reactive, we're gonna take those off and hope all goes well with recovery.
We we are all done with Jack's castration. We are moving on to our next patient, which is going to be Kenzo today.
This is Mr. Kenzo. His castration was very routine. He had no complications. His anesthetic induction was very smooth. And he's had some Banamine, which is a anti-inflammatory pain medication. And he is in recovery. He has some abnormal teeth, so we didn't have an exact age on him. So we're just gonna leave those emasculators in place as long as he's resting peacefully. And then we'll take him off when he starts waking up. We talked earlier about how much harder it is on these older equids to have surgery. And this is Jack. Unfortunately, Jack's surgery went great. He didn't lose any blood, but unfortunately, he's had a really hard time getting up. He hasn't struggled a whole bunch, but you can see he's got really bad scarring of that right hind leg. And what we're seeing is that when he stands up, that leg is just kind of knuckled over and he's not able to place it. So we've been able to get him on his feet multiple times. He's just not able to stay up on his feet. I just gave him some Caro syrup, which is basically corn syrup, to try to get his blood sugar up if that's an issue. We're gonna give him some additional padding. He is on rubber mats, but we're gonna give him a bunch of padding, try to get him in a comfortable position. I'm gonna bring him some water, and we're gonna let him rest, and then we'll see if we can get him up again. Anesthesia is the scariest part of surgery. We have been working on Jack, who's got up and isn't able to stay up. Looks like he's got a really severe scar in his right hind leg that we knew about, but he's having some issues with being able to place that leg underneath him. So we've got him padded in a comfortable position and we're gonna give him a little break and eat some lunch, but I am really concerned about Jack and his ability to get up. But overall, surgeries went great. We didn't have any hemorrhage or any anesthesia complications today, so that's awesome.
So we have this sweet gelding here. He's about 17 years old from what I was told. And we're doing a training evaluation to see basically what he knows and what he doesn't know and what we need to work on. So we just rode for about 10 minutes or so just to kind of see what he knew, what he didn't know. He did very well with me mounting him and walking around the round pen. We do have a lot more go than woe, but he does mind his manners. I think with some nice refreshing, I think he will be a very great gelding for somebody.
They want names on doors, so they have me putting names on doors. Got all the signs put up on the ones so that everybody knows what room what room is what. So we got animals, stalls, treatment room, got them all.
As y'all know, I got in a wreck recently and my truck was unfortunately totaled, which was fine because I got to go truck shopping and I looked at all kinds of different trucks and evaluated all the needs I have and how much I tow and what I tow, and ended up getting a Gladiator because Tawny is always doing useful things with her Jeep, whether it's pulling horses out of the mud or whether it's going boonie whacking to save horses. There's a lot that she gets done with her Jeep, and I think it's a good vehicle, but I had to have a pickup truck to put stuff in the bed, like lumber and things, so ended up with a Jeep Gladiator, and so far so good. So I might let y'all know in like a couple years if I still like it.
Today is a very busy day. We have a big donkey rescue that we're gonna be doing. These donkeys are very neglected, and I have been buried down behind my computer working on very big important projects. So these are the VIP projects, and these projects are amazing. Like, can't wait to tell you about them. But Until then, I am like literally buried behind my computer, and I have had to tell Chandra, shelter manager, like, please take me off of animal care duties. Like, I like to be out with the animals and doing things, but this project is really big priority, and we have a lot of other projects going on top of all of this. So tons of people are going to go on the rescue mission today. I will not be one of them because I will be on a very, very important Zoom.
We are going to pick up a few donkeys. We got a call from, I believe we got a call from the sheriff's department. They had been getting several complaints from a neighbor about these donkeys and another animal on the property, and they contacted us, see if we can come assist. We got all the animals signed over to us, so that's pretty much the hardest part. Now we just got to go and get some panels set up, hopefully lure the donkeys into the panels and then load them up on the trailer and head back here. Alright, so we have everybody ready. Pretty decent sized rescue group going just to be able to help make this go as smoothly as possible. We're going to meet the sheriff over at the property, and we're going to wait until he gets there and gives us paperwork. Then we'll go in and we'll get all the donkeys loaded, and then after all the donkeys are loaded up, we will go ahead and get the paperwork signed and bring them back to the shelter. We just went to the property. All the donkeys look like they're standing right over here. We're gonna try to get some food put out, see if we can lure them over here to get them in a small pen, and then back a trailer up and run them all on and go ahead and get out of here.
We got here a few minutes ago for the donkeys, and we were able to catch 3 so far. They look to be, most of them, at a normal body condition score. It does appear that we have some very severe hoof neglect, some very, very bad slipper hooves, and several of the donkeys appear to be lame. Obviously, I haven't been able to do any hands-on exams, but based on first look, that's what we're seeing. Several of the females have memory development, and so they may possibly be pregnant. And then we also have a little Jack baby who's very cute with his mom. Two juveniles. One of them looks to be quite young, and the other one looks to be probably closer to a year old. So we're trying to get the other, there are supposed to be 9 so far. We've only seen 8. We're trying to get the others up here in this pen. We thought we were prepared, but then we got here and found out that they only like apples and carrots and not grain or horse treats. So we're doing the best we can with what we have.
Over the last 20 years, I've been involved in a lot of animal rescues like this one, and this one's going perfectly normal. It's basically hurry up, hit the road, get there, wait. Everyone's just kind of standing around talking, so I just grabbed a bucket of grain, went out. 3 of the donkeys followed me into the pen. Jordan closed the gates behind him. And so we're just hanging out in the shade and waiting for everybody else to get the other donkeys in here, and then we can load them up. So anyway, sometimes it's nice when they follow. I was a little worried because Dr. Lydia and Kory, when walking past the group, I was working into the pen with their own buckets of grain, shaking them, and I'm like, hey, you're distracting my donkeys.
We're trying to sabotage you.
But, you know, it worked out. These guys stayed focused on me. Dr. Lydia and Kory just kept walking, so that was good. And now, hopefully, the other 5, 6 donkeys, whatever there is, hopefully they get in here soon.
So there's 3 more that we're trying to get coaxed over here. They're very nice donkeys, so we're gonna see if they'll follow us over with a bucket of grain. And then we made contact with the owner of the property, who said that the Jenny likes to hang out over in those trees and that she does not like the Jack, so that's why she's not with the rest of the donkeys.
So we've been trying to load these donkeys for about 30 minutes now. They are being donkeys, very, very stubborn, but we're trying our best.
Well, we finally got all the donkeys loaded after about an hour. Just kept pushing past us, and eventually the officer found a panel that we could use to kind of push them all up, and after that it was just a matter of getting them in the right direction, start lifting tails and getting them to step on. We got 3 more up at the hay barn we gotta go get, and I hope they corralled another one off. I'm not sure yet. We're gonna go find out.
This little Jenny, the lady who's been caring for them said is about 1.5 years old. Apparently their Jack has decided to pick on her, and anytime he sees her, he attacks her. So it looks like she's got 3 or 4 more major wounds. One is on her right forelimb. She's got, looks like a big ulcerated puncture wound on this right forelimb, and then her right ear has been partially removed. She may need to have surgery to have the rest of that ear amputated, and then she's got a lot of wounds over the top of her neck that are consistent with her reported history. So she's been very sweet, and she likes grain. I'm a little worried about her systemically. She's been way out here separated from the group, and it looks like the water source is way down here. So if she was afraid, and we'll grab her a bucket of water as soon as we have the opportunity to do so, but if she was afraid of the water source, she may be chronically dehydrated, or we know she has an infection. But I'm hoping that we can get her back to our hospital and get her the medical care that she needs.
All right, so we got all 9 donkeys loaded. We're ready to go. We're gonna head back to the shelter and take a look at them all and see who needs what and go from there. So we just made it back. We got the one Jenny that had been beat up a lot off by herself. She's in a stall. The vets are gonna make her a priority to look at, and the other ones we're gonna offload by the training barn. We do have a farrier coming out on Thursday, and I think we're gonna make them all a priority to get their feet done.
Hey, my name is Deanna, and this is my daughter Anaya. We are here to have her shadow. She's gonna be going to Mississippi State, and also she's doing a dual enrollment with her high school at UT Martin, and she's going to shadow the vets today, and we're super excited. We can't wait to see everything that goes on here. I've been watching our show for years now, and it's so amazing to actually see the people that I've been watching forever.
We have 2 visitors here at Horse Plus this morning. They have come to job shadow with us. I gave them a quick tour around the property while Dr. Lydia got a few things ready. Today we're going to be showing them a spay on a very sweet dog and whatever else comes up, because things happen a lot here that we don't expect. But I'm super excited for them to be here, and the young girl wants to be a vet, and the lady that is with her is actually a vet tech. So it's very nice that she's throwing things off, and we're bouncing back information, and it's going to be a really fun day for them, and I'm excited.
I just wanted to thank everybody here at Horse Plus. They have been absolutely amazing. My daughter has been able to see so many different things today that she never would have been able to see at a regular, animal practice. So it's been a blessing, and I really appreciate everybody here. They're just rock stars in this industry, and we hope to come back out here again.
My favorite part was probably the neuters. I got some testicles, so I'm gonna show them at school tomorrow to my friends. And the cats. I really like the kittens. I pet one and I held one, and that was fun.
At our horse rescue, we believe every horse deserves a second chance. With love, care, and the right resources, we nurture these amazing animals to health again. But those resources can be hard to come by. which is why we're so incredibly grateful to Parman Tractor and Equipment for their recent donation of this amazing new tractor. This tractor is more than just a machine. It's a symbol of hope. It allows us to deliver nutritious food to our horses, meaning they can recover faster and find their forever homes sooner. Thanks to Parman Tractor and Equipment, these deserving horses will have the strong, healthy bodies they need to find happiness once again.
We named this sweet little Jenny Honey. She is in really rough shape. She came in today. Her owners surrendered her, but Horse Plus went and picked her up from the farm. She was one of 9 donkeys that we picked up this morning, and she's definitely in the worst shape. Dr. Gina is going to talk about her blood work, but she's covered in pretty significant wounds that are very, very deep and very badly infected. Unfortunately, I think her right ear is beyond saving and probably needs to be amputated, but she's in such rough shape that she's not a candidate for anesthesia. We did lightly sedate her. Today she's had pain medications, anti-inflammatory medications, broad spectrum antibiotics, wound care, fly care.
Yeah, so we did a CBC chem on her, and I'll talk about the CBC first, which is a complete blood count. She has a pretty significant neutrophilia, which we're not surprised with wounds, but she also has a normocytic, normochromic, non-regenerative anemia, which is concerning because you want them to regenerate their red blood cells. With her liver, muscle, and also her potassium is at the high range of normal. So it's like 5.2 is our upper limit, and she's at 5.2, so that's creeping up, and increased potassium is really bad. So all these things together with the way her anemia looks, which we know she was kept away from the water on the farm by the other donkeys, but seeing these changes, knowing that she's dehydrated and when we rehydrate her will make it worse, is very, very concerning. Yeah. So that's why she's not a great anesthesia candidate today.
We know, because we had a neighbor documenting in this case, that this donkey has had significant wounds for weeks to months to possibly longer than that. When we treat our patients, it has to be balanced out by accessing them and how safe it is for us and how safe it is for them. But it was very stressful for her to be caught today. It was stressful to ride in a trailer. She's been a really good patient so far, but it's going to be really touch and go. So we'll be praying that she makes it through the night and that she has a comfortable night and that her blood work improves and that we can get her to a place where she is a surgical candidate so we can address some of those wounds.
Hey everybody, today is volunteer day and we have one volunteer and she is doing a wonderful job. And actually she brought us a kitten a while back and she was able to see her kitten, so that was a good reunion. But yeah, right now we're just cleaning out the barn, just trying to get it a little spiffy. After that, we might go clean out a couple of stalls. And I think that will probably be about it.
All right, so PetSmart has an opening for 5 kittens. So today I'm going to be grabbing 5 of our little kittens that we released outside. The gentleman that is going to be transporting them will be here, and then they'll be on their way to PetSmart. All right, I've got all 5 kittens collected. They're going to be staying in here until their transport arrives, and then hopefully they'll be on their way to finding their new forever homes.
So right now I have Torito in here. I believe we got Torito in either the April or the May buyout. He is a 13-year-old Mustang, and I believe that he has been ridden before, and that he's had some stuff done with him. However, when he got here, he was acting pretty green. He actually bucked somebody off. What I like to see before we go ahead and start a horse, we'll cover groundwork and what we're looking for with groundwork before we just throw a saddle on and climb up and pray for the best. So we're gonna get you prepared before that. And I think we'll call that good for Torito for today. I noticed that I was gonna work a little bit on sacking out with the saddle pad, but I think what I'm gonna do is I'm gonna wait until I can set him on him off the fence. Then we'll work on sacking out the saddle pad, and we'll work on getting that saddle on him.
All right, so the transporter's here to grab all 6 kittens. We added an extra, and they are gonna be on their way to PetSmart.
All right, all 6 kittens are off to PetSmart, and we hope they find their forever home.
So we just had a 2-horse owner surrender pull up, and right behind them was a pig surrender. So we're about to get them all unloaded and put away in the barn. All right, we got the pig unloaded pretty successfully. Went pretty smoothly, a lot smoother than the last pig we got. So now it's in exploring its new stall for the time being.
At Horse Plus Humane Society, our goal and mission is to save as many horses as possible out of the slaughter pipeline. Through our buyout program, we are intercepting horses before they even get to the auction. Our goal is to rescue as many horses as we can, bringing them to our organization and letting our expert veterinarians evaluate them to determine what each horse needs as an individual. We help as many as we can, even if they need the last act of kindness, because we believe that every horse is deserving of kindness and medical care and treatment. When horses come here to Horse Plus Humane Society, we're able to tell their stories and transform their lives. But none of it would be possible without support from people just like yourself. So please make a donation right now. The horses are counting on us, and we are counting on you.
So, we are so excited that Cuddles is about to get his forever home. There's a adopter already here ready to take him.
He's been a little contentious because I woke him from a nap. But yeah.
But yeah, you can choose whichever cat.
And we have several other kittens out there too.
He likes to climb on your shoulder a lot too.
Please don't fall.
Yeah, don't let him jump.
Would I be able to go see the other cats?
Your
I might do this one. I might do this one if I he's so cute. It's a he, right?
Yeah, I just want to be an indoor baby.
I'm a little orange crackhead.
If his microchip number doesn't match, he snuggles.
It's your choice. You're a cat.
Can I get both of them?
Oh, no, no, I didn't hear that part.
So we found Twix, and actually Twix did get adopted, and we're so excited. He is so lovable and so cuddly, and he's everything that she wanted, so we're so excited for her. Do you remember?
So we are here with Mr. Glimmer, Mr. Handsome Man. Yesterday they brought him into the training barn to just kind of groom him and check him out, and they called us over to come look at him because he was really struggling to breathe. And I listened to his lungs, and he had horrible, horrible noises that showed with how difficult he was breathing. And even now you can see he's better than he was yesterday, but he's still having quite a bit of difficulty breathing. And we've changed his medications recently to try and adjust and help him, but the heat and the humidity is just not his friend.
He responded well to the medication change. We made that earlier in the year. Unfortunately, Heave's cases, heat and humidity are not our friends, and neither is dust. So in winter, we're feeding hay, which is very dusty, and even though we try to mitigate that, he had a pretty tough winter last winter and dropped a lot of weight. Felt a little better in spring, but the summer has been tough on him. Dr. Marina came, and our radiology consultant, she also found some fluid around his left kidney, which was a big concern to us. We haven't picked that up on blood work, but we don't see kidney value changes until 60% or more of both kidneys are affected. So we know that he has an issue in one of his major body systems. I think he had some abnormalities on his liver as well. And then his lungs had some really, really concerning patterns that indicate chronic inflammation. Horses are obligate nasal breathers. So unlike humans, if they've got congestion or have difficulty breathing, they can't breathe through their mouths. In his case, the issue isn't just in his nasal cavity, it's his whole lungs. So we're starting to cross that threshold into discomfort despite our best efforts. So it's really hard for our whole team because we love him and he's been here a long time, but we want to make sure that he's comfortable and that he has a wonderful quality of life. And we never want to keep an animal around just because it makes us feel better. We want to advocate for them. So what we're hearing with Glimmer, normally with these inflammatory cases, we have a squeak or an inspiratory wheeze, and with Glimmer, we have like a full-on sound on both inspiration and expiration. That was hard to hear. Dr. Gina and I discussed, and Glimmer's lungs sound pretty awful. So I don't think there's a lot we can do to keep him comfortable at this point. And we're recommending the last act of kindness.
The education center is coming along amazing. We're hopefully within 2 weeks of being completely done with it. And we're not going to take you inside until it's done because I don't want you to get discouraged. And if you're on the members, you can see inside. But we're going to be having a super grand opening here pretty soon. And I can't wait to be able to take you guys on a tour of all the offices with the murals. And it's just going to be amazing. But painters are in there, drywallers. We're getting this thing wrapped up real fast.
So today we have some adopters and they are very interested in Crixus. So we are going to pull him out and see how they like him.
Old hips, old legs.
So do you want to adopt Crixus today?
I would love to.
He is right here. Oh, look at that boy. I'm Janice, and I'm here to adopt a horse. And I didn't realize that I'd fall in love at the same time, but I fell in love with Crixus. He's going to be mostly in the pasture. He's got 350 acres to roam around in, and then he and I will hack around on trails. I've been following Horse Plus for years on the internet. And 2 weeks ago, my granddaughter came and adopted Crixus' stablemate. And so they'll be friends in the pasture. Crixus is just the right amount of good energy and calmness. He listened really well. I watched his whole demeanor and attitude as he was being ridden by Taylor, and he listened as best he could with all the chaos going on, but yeah, he's good.
So Crixus got adopted and they loved him, and the transporter will be coming Monday to transport him to his new forever home.
This is Sweet Little Honey. She is the Jenny that came in on Monday? Tuesday. She's the Jenny that came in on Tuesday. She's feeling a little better. She still obviously has a lot of major concerns, but we're gonna do a bandage change on her today and kind of recheck everything and get her some more pain meds and kind of come up with a treatment plan. We were really concerned on day one that she wasn't gonna pull through, and she still has a ton of major concerns, but she's a lot more stable now. She's much better hydrated, so that's great. So we're gonna take the bandage that we put on day before yesterday off. The one that was on her ear unsurprisingly fell off. Ears are a pretty tough area of the body to wrap. So we're gonna take this off and the bandage on her leg off, and we're gonna get everything really cleaned and get some more topicals on. We were able to put some topicals on her ear yesterday without sedation. What's really sad about these wounds, this is repeated trauma over time. This isn't like one event. This is like the same parts of the body were targeted. Same thing with this leg. She's got 3 different wounds. I am using sterile fluids to rinse the chlorhexidine out of this ear. This tissue is so sensitive and painful that the least amount of additional irritation I can do to this poor little donkey's ear, the better.
There's the opening.
Yeah. Infected, inflamed, swollen, painful. I mean, all of the above. But the smell is much, much better. And I definitely see improvement in all of her injuries. We just finished doing a recheck on Sweet Little Honey this morning. Clinically, she looks brighter. She did get a little bit of a sedation, which is why she's standing there like that. She's eating and drinking very well. Her electrolytes improved, her hydration status improved. Unfortunately, her kidney and liver values are both creeping up. So she still has some major abnormalities. Her blood work showed that she is responding to her antibiotics. So the infection is improving, the smell is improving. And I modified her ear wrap a little bit. Hopefully that will stay on for a few days. And still touch and go. She's more systemically stable from the outside than she was before, but we aren't happy that those organ values are creeping up. So we'll continue to hope and pray that we can get her turned around. She is really coming around to us. Initially, she was very afraid, and she's getting better and better about being around people, so that's awesome.
When I first saw Glimmer, I knew he needed help, and I knew he was a horse we had to rescue because I knew he had a story. But he was in stacks and chains, and he looked like he had just come out of a show. And I knew that the Big Lick folks threw away horses at auctions when they became sored, and I did not have. I mean, I think he was the second Tennessee walking horse in stacks we had rescued. I went to make a phone call, and I called Clint, and he has passed away now, but he was the only person I knew that was speaking out against the Big Lick. And I'm like, hey, this is this horse here, and I think we need to save him. He's a registered Tennessee walking horse. He's in stacks and chains. And he's like, look, I'll help put up the money to get him. Let's get him. I went and I pulled him out of that trailer and I walked him and put him into our trailer, and I took these photos, and I could see how damaged he was. He had chemical burns, like there was no hair on his legs here. It was all just raw, oozy chemical burns. Glimmer became a huge part of the advocacy work we are doing to speak out against the abuse of Tennessee walking horses and for being shown Big Lick. And Glimmer, you know, probably at a very young age was trained to do the Big Lick, and he would have had his tail tendon cut so his tail could be basically yanked up and harnessed. Some of these trainers, they'll put like raw ginger around and in the horse's anus to cause more irritation, to put them in. So the torture and horror that Glimmer went through is beyond belief before he was rescued. I was always just hoping that Big Lick would end and that Clint would see it end, because Clint was such a fighter to end the horrible abuse that happens. And I got the call that Clint had passed away. He was such a warrior for the cause of ending Big Lick, and I knew that Glimmer would be coming to us. And I went to Clint's funeral, and then I went and picked up Glimmer and brought him here to Horse Plus. It's been amazing having him here. There was always a bit of me that was like, you know, like he needed to be with Clint and be that advocate for horses. But I always like wanted him here at Horse Plus. This spring, I started worrying about Glimmer, because Glimmer's always kind of had these breathing issues. But this spring I could just tell that he wasn't himself from the horse that I knew he was for so long. Like, he's not doing good. And I talked to Lydia at one point, because I'm like, it looks like he's starting to lose some weight. And she did blood work on him and everything looked okay, but there just was an ongoing issue. And then, you know, he was on medication for his breathing, and we got a wonderful donation of an amazing ultrasound, and there was an expert came in to use the ultrasound and found that Glimmer had some really significant problems in his lungs, and then also around one of his organs. I was hoping he could have another winter with us, and, you know, another spring and maybe another summer, and it just wasn't meant to be. But he's always gonna hold a very special place in my heart. He taught me so much about Big Lick and the reality of what these horses go through. And because of him, it really inspired me to fight for these horses that have no voice. And when I go to Washington, D.C., I talk about him and I show his pictures. You know, first it was Clint. When Clint died, so I would always reach out to Clint and I was like, hey, I just rescued this Tennessee walking horse and this is his registered name, and he would search and be like, okay, well, this is who the horse is. And when Clint died, I couldn't reach out and be like, hey, you know, get advice on these Tennessee walking horses. And there comes a point with health that you've got to say goodbye. And today was that time, but I'm thankful that day I was so insistent on rescuing him, because if we didn't rescue him, it's really hard to say what would have happened to him. He could have gone on to slaughter. He could have just disappeared like so many other Tennessee walking horses. But it's gonna end, and it's gonna end with your support. So please be a voice for Tennessee walking horses. Support the PAST Act. And share anything you see about Big Lick so people can become aware and it will end. It's very important that we don't forget the heroes along this path who did everything they could to raise awareness